Hi, my name is Takia Shipman, and today I want to talk to you a little bit about behavior theory. First, I want to start with some of the major concepts or assumptions about that theory. The first major concept is that behavior is what a person does, thinks, or feels that can be observed. And pretty much what that is saying is that anything a person does, behavior-wise, their actions, it has to be observable. Behavior can't be what a person is thinking. It has to be something that you can actually see with your own eyes, and it can be witnessed and observed. The next major concept I wanted to say is that people are motivated by pleasure and pain. They're motivated to either seek pleasure or avoid pain. That is basically saying that all people have an innate drive to seek out something that is pleasurable to them or to avoid something that's painful to them. And that is an innate drive that actually influences behavior. Your behaviors are based on those drives. And that's what motivates people to behave the way they do. The next major concept I wanted to say is that behavior is something that is learned through environmental cues. Now, what that means is that it's saying that all human behavior, all actions can be learned through their social environment. And your social environment actually teaches you what is considered right or wrong, what is socially accepted behavior, what is not, what is considered normal behavior or abnormal behavior. And it's basically saying that whatever your social environment actually tells you is what you're going to learn. So behavior is able to be learned. The next major concept would be that behavior is able to be changed or modified. So it's saying that no matter what the behavior is or how it started or when it started, it is able to be changed or modified. You can change somebody's behavior. It's another major concept is saying that thoughts and feelings are considered behaviors. So yes, anything that you're thinking or you're feeling is going to manifest itself through your actions and through your behaviors. So all of your thoughts and your feelings are considered behaviors. And the last major concept that I wanted to mention was that the behavior theory prefers the simplest explanations for behavior. It does not want to seek out any underlying reasonings or causes of that behavior. It doesn't want to know why people behave the way they do. They don't want to focus solely or mainly on the why and what's causing the behavior. They just want to focus on the behavior itself. They want to find out what the behavior is so they're able to either change it or modify it. Next, what I wanted to talk to you about were some of the major theorists involved in behavior theory. For instance, the first major theorist was B.F. Skinner. Now, he was a strict behaviorist. He did not really believe in incorporating other theories with behavior. He just solely focused on the behavior theory and solely focused on all of those different concepts of behavior. And he was mainly associated with a specific principle of learning called operant conditioning. Now, later on, I'm going to elaborate and explain all of these principles of learning, but for now, I just want to focus on the theorists. So our next person would be Ivan Pavlov, and he was more so considered the father of behaviorism. He is the person that kind of pushed the behavior theory into what it is now. He's more so associated with classical conditioning. And the next and last theorist I wanted to mention was Albert Bandura, and he is more so associated with a specific learning principle of learning or social learning concept called modeling. And modeling is just like a social learning theory. It goes back to saying that behavior is able to be learned, and modeling would be a form of that, and that he's associated with it. And all of these different theorists, they all believe that the environment determines behavior. So that all goes back to people learning different behaviors through their social environment or whatever their ecosystem, their environmental cues, and how they learn it. Either way, no matter how they learn it, is through the environment somehow. Next, what I wanted to focus on are all the different principles of learning. All of these different principles of learning are what influences behavior. Everybody's behavior can be influenced through these next three principles of learning. And it's also, I have a quote by Bradford Schiffer and Charles Haragi, and they say that to improve the functioning of individuals, couples, families, organizations, people must learn new behaviors. So with that being said, I'm going to go into detail about the different principles of learning and how to learn new behaviors. And operant conditioning is the first learning principle. And again, we're going to go back, that's associated with B.F. Skinner. And what this is it uses rewards and punishments to increase or decrease a person's behavior. And through these rewards and punishments, and through these ways of increasing or decreasing the behavior, something called reinforcements are used. Now, there are positive reinforcements and negative reinforcements. And an example of using operant conditioning would be a child who is supposed to do their chores. Say they need to clean their room, clean the kitchen, take out the trash, etc. And they also want to go outside and play with their friends. A way to use a negative reinforcement on the child, if the child does not complete their chores, a negative reinforcement or punishment would be that the child cannot go outside and hang out with their friends. And if the child does complete their chores and take out the trash, make up the beds, etc., a positive reinforcement or a reward would be that they are able to go out with their friends. This is an example of operant conditioning and how it can be used. The next principle of learning is classical conditioning, and this principle of learning is associated with Ivan Pavlov. And basically what this one does is it places a neutral stimuli with an unconditional stimuli, and it triggers an involuntary response. Now, the best example that goes with this is the famous dog bell experiment that everyone has heard about. Basically, in a nutshell, the owner would ring a bell and feed the dog right after he rang the bell, simultaneously at the same time, and he would do that over and over again, to the point where when the dog would hear that bell ringing, he would expect to be fed. He knew that it was time to be fed. He knew the food was coming, and his mouth would begin to salivate. And so now whenever he hears the sound of that bell, his mouth automatically starts to salivate before he even is able to see the food, because he associates the sound of the bell with being fed and getting ready to eat. So the neutral stimuli was the sound of the bell, and the involuntary response, which the bell triggered, was the salivation of his mouth. That is a prime example of classical conditioning. And the next and last principle of learning is modeling, which was associated with Albert Bandura. And pretty much this one, it just says that people learn different behaviors by watching other people engage in the behaviors. So an example of this could be if I had a client who was a mom, and a client and her daughter, and her daughter is going around stealing different things that she wants that she cannot have, playing with things that she's not supposed to, doing things without her mother's permission. An example of modeling behavior could be if I'm sitting with the mother in front of the daughter. Me and the mother could role play, and we could actually model appropriate and correct behavior in front of the daughter. If I was to pretend I was the daughter and ask the mother, "Mom, can I please have that toy so I can play with it?" Instead of just taking the toy without asking, I would ask her and wait for the mother to give me permission to play with it or not. And if we model that in front of the child can learn that by watching us and watching the appropriate behavior, therefore learning a new way to behave, learning the correct way to behave. And those are all the three different principles of learning and how they can affect behavior. Okay. Okay, and next what I wanted to talk about were some of the different assessments and interventions that come along with the behavior theory, or that's used in the behavior theory. And when you're doing an assessment, it's important to establish that strong social worker-client relationship. You want to make sure as a social worker that you have great empathy skills. You want to make sure that you're coming off as competent and caring and trustworthy with that client, because you want that client to be able to trust you and feel comfortable with you, because eventually what you're going to do is you're going to want that client to engage in new behaviors and different behaviors from their own, and they're not going to want to engage with you on those and changing those behaviors and doing those new behaviors if they don't trust you, if they don't feel like that you're empathetic towards their behaviors and towards them as a person. If they feel like you're judging them or you're punishing them, they're not going to want to engage in that new behavior. They're going to be very resistant, and that's not what you want. So you want to make sure that social worker-client relationship is very strong and you have a very good rapport with that client. Different ways to assess the client: you can use something called a functional behavior analysis. This is basically different steps that you would use to assess the client. The first step would be to clearly identify, specify the problem behavior. What are the behaviors that are causing issues? What are the behaviors that needs to be changed? The second step would be to identify the environmental cues that maintain the behavior. So identify what has allowed this behavior to go on for so long and continue. And the third and final step would be to consider the consequences of those behaviors. And you want to just analyze what type of things may happen, what different consequences, negative or positive, all consequences that may happen if the behavior does not change. Something else that can be used as an assessment is something called eco-behavioral assessment. And with this is similar to the functional behavior analysis, only it's more so looking at the client from a broader point of view, looking at the whole system, looking at their whole environment, everything that affects them as a whole, their whole ecosystem. And with this, what you're going to use is an eco map, and you can just pinpoint all the different things in their lives and in their environment that's either affecting their behavior or affecting them or causing them to behave in this way. All of these assessments, they can help the client and the social worker see how these behaviors may be a problem, and it can help the social worker to determine the different reinforcers and the triggers that maintain the behavior, or the different things that she may need to do to go about changing that behavior. Next, I want to talk about the intervention. How would you go about using an intervention if you wanted to use the behavior theory? And basically, when you're trying to find an appropriate intervention, you just want to make sure you gather as much information as you can. A lot of baseline information about the client's behaviors, good and bad, mostly the bad behaviors, because that's what you want to change. You want to know what steps are going to need to be taken to modify that client's behavior. And this is very important because it helps the social worker to determine the correct intervention to change that behavior. So all of these different assessments are key things that can help choose the intervention. And a specific intervention that I wanted to mention is systemic desensitization. And through this, you use something called exposure therapy. I wanted to mention this because I'm going to actually use this in my skit. But exposure therapy basically just requires the clients to gain experience with whatever things they may fear or cause them great anxiety. You want them to actually experience those negative feelings and those negative, those feared feelings, those levels of anxiety rising. You want the client to experience that through exposure therapy. You want to expose them to those things to show them that those things are not dangerous. They have no reason to fear those things. They have no reason to get all worked up, and their anxiety doesn't need to rise. And through exposure therapy, what you can do is you start off small, maybe with some visualization techniques, you don't want to start them too big. You want to have them visualize whatever it is they may feel, whatever it is that may cause them anxiety, and have them acknowledge how they're feeling right then and there. And then you want to gradually introduce them into whatever that object or thing is that they fear. And you want to gradually introduce them to it more and more, which is called systemic desensitization. You want to, do it as a system, just one step at a time. According to Camille from NYU, systemic desensitization can remove specific behavior, and it can actually reduce manifest anxiety associated with that behavior. So this is also a great technique that you can use within the behavior theory. Next, what I wanted to do was mention a little bit about spirituality and social justice as far as behavior theory. Now, spirituality, when it comes to the spirituality and higher forms of power and focusing on life's purposes in terms of human behavior, behavior theory doesn't really pay much attention to that. It doesn't focus as much on that because it's very concrete. It wants to focus solely on observable behavior. So they don't want to explore those deeper meanings, those deeper feelings, and spiritual connections that the human behavior or the person may connect with the human behavior. They just want to focus on what the behavior is so they know how to change it. As far as social justice, however, it does contribute a decent amount to social justice and social justice issues. Social workers, they have an important collective reinforcements like knowledge and money and economic statuses. So social workers can actually, using behavior theory, can actually help and benefit when it comes to social justice issues. Behavior methods can promote a range of social justice issues like, let's say, efficient household energy consumptions, trash control, and as far as racial integrations and how to help a client become comfortable with that. And that goes back with like cultural competence. If a person wants to be culturally competent, or if a social worker is culturally competent, they can understand that some people may not feel comfortable with racial integrations, and they may exhibit some behaviors that are not appropriate because of that. And a social worker using behavior theory can actually help to change or modify that behavior so that it is appropriate to the different cultures that a person may be integrated with. So that's how it can definitely help with, within social justice issues. Like all theories, behavior theory is not perfect. It has its limitations. One of the limitations it has is that it's criticized because it doesn't focus enough on the biopsychosocial spiritual aspect of human behavior. And, it doesn't want to explore that deeper meaning. It just wants to focus mainly on observable behavior, and it's not broad enough. It's not looking at the whole picture and the systems part of it and the other aspects that may affect behavior itself. So that's one of the limitations of the theory. Another limitation would be like the interventions. They rely too heavily on controlled environments. For instance, going back to operant conditionings and the application of reinforcements. You cannot always assume that this is going to work for that client. Positive and negative reinforcements do not always promote a change in behavior. Every client is different, and sometimes you do need to explore that deeper meaning, and you do need to try other techniques to promote change in behaviors. So that is my brief summary of behavior theory. Next, what I'm going to do is show you a little skit or role play exhibiting a social worker using behavior theory to treat her client.
Hi, how are you doing today?
I'm fine.
Okay, well, my name is Miss Jones, and I'm going to be a social worker for today, okay? Okay, and what's your name?
Kim.
Kim? Okay, nice to meet you, Kim.
Nice to meet you as well.
Okay, and just to clarify, I'm going to be writing some things down just to help me remember just some things that you say and just to make sure that I'm actually understanding everything that you're trying to say and try to get across. Is that okay with you?
That's fine.
Okay. And you say your name is Kim?
Mm-hmm.
And if you don't mind me asking, how old are you?
I'm 20.
20? Okay. So Kim, what brings you here today?
I have a problem with standing in line with crowds and riding the bus with a whole lot of people. Public bus.
Okay. So I'm hearing you saying that you have some issues with different public transportation and being around other people and other individuals. Can you elaborate on that? What type of issues do you seem to be having?
I just be all uptight and it makes me really nervous. And,
Nervous?
yeah.
Okay. And I'm noticing that you're kind of jiggling your legs right now and you're kind of fidgety. Is everything okay? How are you feeling right now?
I'm okay, just the thought of it, and thinking about it, it is,
So it has you a little shaken up or rattled?
yeah.
Okay. So, I'm writing this down. So you're saying just when you're out and you're around other people or in public areas and just thinking about it has you kind of tensed up and rattled and you just don't feel too comfortable?
The crowds and germs and, this kind of freaks me out.
Okay. So would you say, do you have a little bit of anxiety issues with that?
That's what my mother and everyone else is telling me, so
Okay.
not sure.
You're not sure? So do you have a fear of these places, a specific fear? Or how are you feeling? Like, if I were to ask you a question to rate how you feel when you're out in these areas, I just want you to close your eyes for a second. And I want you to picture yourself in the middle of this, not the middle of the street, on the sidewalk. And you're at a bus stop and you're waiting at a crowded bus stop where a whole bunch of people are there waiting with you. And then the bus comes and you're getting on this crowded bus and it's just full of people. And I want you to tell me how you feel in that moment.
All the germs and the coughing and all the people around me, what they're gonna do, what's gonna happen to me, and it just scares me.
Okay. And as far as you being scared or in fear of this, if I asked you to rate it on a scale of 1 to 10, what would that fear level be?
About a 7.
7, okay. It's pretty high. Should be about a 7. So can you tell me how long have you felt this way? When did these symptoms maybe first start?
When I was a little girl.
Okay. Around elementary school ages or junior high, or give me an age range.
I think I was about 9.
9? Okay. 9 years old. Okay, and have you tried anything, before coming here, have you tried any alternative methods to try and help yourself alleviate or ease this issue of anxiousness or anxiety?
I've tried get on the bus a couple of times, but just kind of scared because I had to walk to work about 20 blocks because I can't ride the bus. I think it's maybe because when I was younger, I got on the bus and it was like a flu going around. I got sick and I was in the hospital for a couple of days, and just being in crowds with people and the germs, it just kind of freaks me out. I've tried, but as soon as I walked on the bus, this old lady was like, and it just, I had to get off at the next stop.
Okay. So, and you did mention before how being around crowds freak you out. So you walking those 20 blocks, I imagine it had to be hard for you just passing by all of those people, walking those blocks. It was just, I imagine your anxiety level was pretty high at that time as well.
Yeah, I kind of try to leave early when a lot of people are not out. So that helps.
And again, I still notice that you're jiggling your legs and stuff. So is talking about this making you feel a little bit uncomfortable?
Yeah, a little.
Okay. Well, I want to try something with you here today. Okay. What we did first already is we visualized. I had you close your eyes and tell me about how you felt if you were to get on the bus. So that was called visualization. And I asked you to rate how your anxiety level was, and you told me it was a 7. Okay, so what I want you to do now is I want you to notice how you're feeling just talking about these issues and noticing your jiggling and your fidgetiness. You're still you're at a pretty high anxiety level still. Am I correct?
You're correct.
Okay. So what I want you to do now is I want you to try a breathing exercise. What I want you to do now is when you feel your anxiety level rising and you feel yourself getting scared or in fear of other people and other places, I want you to try just counting, and I want you to try breathing, okay? So just watch me. What we're going to do is something called modeling, right? And I'm going to actually pretend that I'm you, and I'm in a crowded bus stop again, okay? And I'm just waiting for the bus, and there's so many people around me, and I'm getting all fidgety and scared, and my anxiety level is rising. I just want you to watch what I do to try to calm myself down, okay? Do you see what I did there? Okay. Now I want you to go ahead and I want you to try it. Now I want you to visualize again first, okay? This time I want you to picture yourself at an amusement park. And amusement parks can be very crowded, very busy. So many people there. Little kids running, screaming, laughter, everything's going on. So I want you to feel your anxiety level rising. And I want you to really notice how you're feeling, just visualizing and thinking about that, okay? And then I want you to try calming yourself down and using the technique that I use, okay? Good. Good, that's very good. How do you feel now?
I feel better.
Okay. Now can you rate your level of anxiety or fear on a scale of 1 to 10 again for me and tell me where it is?
That's a 4.
4? Okay. So you went from a 7 to a 4. That's a drastic change. That's pretty good. And do you think you can, if you find yourself in these type of situations again, do you see yourself doing this type of exercise, and do you see it working for you in the future?
I can try.
Okay, that's good. That's good. Well, I'm going to end the session here right now for today. And what I want you to do is go ahead and try those exercises. And I just want you to, before you actually try it, I want you to realize your anxiety level is rising. And I want you to notice that. And I want you to try and rate it. And then I want you to try the technique and just breathe and counting. And then notice the level slowly coming down. And then I want you to rate it again. And that way you notice the difference. Right now, you went from 7 to 4. So once you notice the difference, you'll know how to calm yourself down and how to bring your anxiety level down on your own, okay? So I want you to go ahead and try that for a week, and we can meet next week. We can talk about how everything went down, okay?
All right, thank you.
No problem.
Well, as far as reflections go, what I noticed in the session was that the behavior theory actually worked very well for this particular client and her particular behavior problems. I feel like the theory actually provided good intervention strategies to help her with her behavior, as far as desensitization exercises, visualization, exposure therapy, and the modeling exercise really helped to model her, to model new behavior that she could do, or to model different techniques as far as the counting, me modeling for her what she could do to reduce her anxiety levels and change her behavior. What I also noticed is that from the DSM-5, it's actually my professional opinion that she gets, I guess, referred to a psychiatrist so they can actually diagnose her with agoraphobia, because it's looking to me that she's actually fitting the criteria, exhibiting all of the different symptoms and signs for agoraphobia. And I feel that behavior theory can really help with this. There was a time where she mentioned that when I asked her the question, when did she first notice these different fears of and anxiety happening? And she mentioned that maybe when she was younger and she noticed that there was a flu going around and everybody was on the bus sick, coughing, and etc. Well, initially I really wanted to go more into detail with that in her memory in the past and how it affected her, but behavior theory doesn't really focus on that, so I knew I had to just kind of just make a note of it and just kind of leave it there and just redirect the conversation and focus more on the behavior itself in the right now. Also, I feel that noticing her different behaviors as far as how tense she looked and jittery, and mentioning the leg jiggling, I feel that's another aspect of behavior theory that was appropriate to mention during the session, because the social worker really needs to notice what the client is doing right then and there during the session, and because it can actually help to determine what's going on with the client and the different behaviors that they're exhibiting. So mentioning or addressing the different jitterness and the leg jiggling and the fidgetiness, I feel like that was also a plus as far as the counseling session went. I would actually want to incorporate other theories on top of behavior theory, because I don't believe that behavior theory, even though I do think it went really well with this particular client, I still feel that there are other issues that I wanted to explore. So I feel like I did not do my best in helping my client, because I feel that I was kind of restrained or constricted to only using this particular theory. So I feel that I could have done better, especially using other theories. It would have allowed me to explore different aspects more with that client. Other than that, I think the session went pretty well, and I think I exhibited the behavior technique pretty well to the best of my capability. I was still asked for further consultation from my supervisor, just to get further details and just to seek further supervision on what I could have done better. And that's it.